Hello there, this is Dr. Brownhilda Santo. We get another interesting topic today, leg edema. In fact, some people will ask them, now what did it happen when my food is swelling? It is so I get for big concern or that's just something we are not get for worry much about them. We'll see what way if it cause you forget edema. Before that though, we'll also talk about how this edema it come about. First of all, we'll start even by defining what it be edema. Edema dey happen now when you get fluid wey build up in your tissue them, wey bookman dey call am say interstitium. So this interstitium or this tissue then they be found everywhere in your body. So edema fit happen for any part of your body, but we will talk about the leg today mostly. So now, Mo will start by seeing the mechanism. More see this short presentation about how edema be formed, and then we'll come back now. We'll talk about some of the conditions then way if it cause you forget edema.
So now more see how blood dey circulate for body and how it fit lead to this edema. When oxygen-rich blood leave the heart, this blood so it be rich in oxygen and nutrients, and the arteries, that blood vessels and way you see them for this so in red, now they carry the blood will be rich in oxygen and nutrients from the heart, and then it continue, it go to smaller vessels them, so it reach for those vessels where they call and say capillaries. The capillary so now they in contact with the tissue them, and for this level for capillary way you will get exchange of oxygen and nutrients from that capillary into the tissue, and then you will get waste products them from the tissue. They will come back now to the capillaries, and then it will be carried now through the veins. That vein that they be represented by that blue color, and then it will go back for the heart. It is so now all the fluid from the tissue, it will come back to the capillaries. Some of the fluid will remain inside tissue. The lymphatic system will be represented by that green color. Now it go now help for remove the additional fluid where it remain for tissue. It take them back to the veins and then to the heart. So anything where it disrupt this process, it will cause increased fluid in the tissue, and as a result, it will lead to edema. In order for this edema to happen, if you get anything where increase pressure inside the blood vessels, which way bookman they call and say increase hydrostatic pressure, it will make a more fluid go leak from that capillaries into the tissue, and as a result, it will cause swelling when an edema. Also, if you get low protein inside the blood vessels, in fact, some particular protein they call and say albumin, when it help for maintain the fluid where they circulate inside the vessels them. So if the protein low, it means say more fluid go leak out of that capillaries into the tissue, and we'll see example sooner for some condition the way if it cause low protein, and as a result increase fluid go leak into the tissue and then cause edema. If you get also any condition where increase that capillary for leak fluid, for instance, if you get like infection where it will lead to that capillaries them, for the walls and for the capillaries them for leak more fluid than it normally should, then you will get now more fluid where go into the tissue, and so it will cause edema. Another mechanism for edema, it will happen now when you get that lymphatic system where they in green. So if that lymphatic system, remember say I don't talk say it help now for remove the rest of the fluid from the tissue back to the veins. So if you get anything where obstruct that lymphatic system if functioning, then more fluid will remain now for that tissue, and as a result you will get edema.
So we don't just see the mechanism where they cause edema. More now start talk about the condition them where if it cause edema, and for make am make easy, we'll go look at those different mechanisms them. Remember, so we don't talk about 4 ways and where edema be formed. So more look at the first category. For condition the way they fit cause edema by increasing that pressure inside blood vessels them. What will be number 1 condition? Heart failure, fit do am. Liver failure, fit do am. Kidney failure, fit do am. It is so pregnancy too, if fit do am. Some medications and way would take am, like steroids them. Example, prednisone, methylprednisolone, dexamethasone. And I call am so na because when I fit dey on this medication, then when I fit recognize the name. Some other blood pressure medication in their way, if it also cause you swelling using this mechanism. Amlodipine, amphilodipine, if it cause am. Another condition where if it cause increase in that pressure inside vessels, especially for the vein. Now, what they call and say deep venous thrombosis, when a blood clot, where if it happen inside vein. Also, another condition called chronic venous insufficiency or stasis, where it happen now when you get that valves and that vein there, so it gets some valves and where it help for move blood along towards the heart. If that valve is not work fine, it be insufficient, blood go back up into that capillaries and then more fluid go leak into the tissue. So if you get chronic venous stasis, if it also cause you for get swelling and edema. Now more talk about the second category of conditions where if you use another mechanism for cause swelling or edema. Remember, say I don't also talk say when the protein levels inside the blood vessels it be low, then blood fee leak more, fluid fee leak more into that skin for cause edema. The particular protein what they talk about now albumin. So any condition where it go cause low albumin in the blood vessels, it go if it make you get that edema. Number 1 na wetin liver cirrhosis, when a chronic liver disease or liver failure. In fact, this liver failure they so if it cause that edema with using more than 1 mechanism. Remember, so we don't talk about them for that first category also. So because the liver na it be the main organ where it produce, where it synthesize that protein where they call say albumin. When you get liver failure, you need to synthesize that albumin again. So because of that, the protein level, the albumin, it feel low, and because of that, you feel also get edema. Another condition now malabsorption. So if it be so you chop and you get some kind of disease where it make them you know if you absorb nutrients and fine, if you make your protein low. Malnutrition also, if you make your protein low because you not be nourished and you not get nourishment, so your protein too go be low. If you also cause you forget edema. A particular type of kidney disease that they call say nephrotic syndrome, where it make them you urinate a lot of protein. So even when you chop enough protein, but you pee the protein, you urinate them. Because of that, you will get less protein inside your body. And some other kidney disease than they where it make you lose protein too. Diabetes, when you get diabetes where not be controlled, where affect your kidney, if you make you lose also some amount of protein. So liver disease, kidney disease, malnutrition, malabsorption, they fit all cause low protein, and as a result, it will cause edema. More look at the third mechanism and conditions and where they fit use that third mechanism for cause edema. Remember, say we talk about that capillaries, when at that area where you get exchange of fluid between the tissue and the blood vessel, where they call and say capillary. So anything where it increase the permeability, so it increase the walls of that capillary for leak more, it will cause more edema. Example na cellulitis, where cellulitis na waiting. Now inflammation and infection where it involve the skin. More look at conditions and where they feel use the fourth mechanism for cause edema. Remember, say I don't talk say that lymphatic system there, so it be very important for drain the excess amount of fluid where they for tissue for bring them back to the veins and then take them to the heart. So anything where it affect the functioning of that lymphatic system, it will cause edema. Example na a condition called filariasis, where if it cause elephantiasis, or wetin wey bookman dey also call am say lymphedema. Also some cancer dem dey wey if e affect that lymphatic system, or if they do surgery and remove that lymph nodes dem wey I talk wey be part of that lymphatic system. Example fit happen when person get like breast cancer, where sometimes the way they go remove the breast and then also remove the lymph nodes them for that lymphatic system. When they do and so, it don't damage that lymphatic system, and you go see and where some person go get swelling for your arm after where you don't get like breast cancer surgery. So anything where affect the functioning of that lymphatic system, where make I know the drain fine, either because they move the lymph nodes, because it obstruct the lymphatic system, or even if the cancer they press on that lymphatic system blocking the drainage, if it cause edema. So one other disease the way you need to use any of this mechanism the way I don't mention and so, but it cause edema. And the way they cause edema, and I say it make some certain protein that they go stay inside our tissue, that they infiltrate the tissue. Now this condition is hypothyroidism. So low thyroid levels, thyroid hormone they so it be important for many things and for our body. So if it cause some particular protein them for infiltrate, go remain for inside the interstitium or tissue, and then it will cause edema. It is so all the conditions that I don't mention them, they cause way they call and say pitting edema, except for that elephantiasis and hypothyroidism, their own kind edema they so it no be pitting. I go show una way it means say pitting, how una know whether una get pitting or una no get pitting. For find out whether you get pitting edema or not. So what you go do, I go demonstrate them. So you take your leg, now like this, okay? You take your finger, you put them for your skin, then you let go. You put them, let go. You see how my hand, my skin, it just bounce back. If it just bounce back, you don't get pitting edema. But if you put them there and then it remain, you know, I will show now some pictures them. When I watch the pictures them, when I see how they saw this pitting edema, that person press them and then it just remain. When you press them so it remain, they call and say pitting edema. And I think that they call and say pitting edema. So when I don't see say we don't talk about what to be edema, the mechanism then way if it lead to edema, examples them for some conditions and way they fit cause edema. For our next video, we'll go talk more about certain conditions, then we'll go bring some common conditions then where they dey for community. I go talk more about them and other signs and symptoms then way together with that leg swelling, if you make and you suspect say you get that condition. And then what if you do when you suspect say you get that condition. I hope say when I don't get something out of this video. I do invite when I say when I share, when I comment, when I like, when I subscribe, when I remember say knowledge is power and health is wealth. Dr. Brownhilda Santo. Thank you.